Hey guys, it's Derek Z, physical therapist, and in today's video, I'm going to show you some low back stretches to help with a disc herniation. Unfortunately, not all low back pain is treated equally, so you can't just do one exercise and treat all types of low back pain. There can be many different reasons for why there's pain generated from the lumbar spine. The exercises in this video are specifically tailored for a disc herniation that results in flexion intolerance. So flexion intolerance is basically your inability to tolerate activities that require bending of your spine. So anything that requires you to bend or anything that requires you to bring your knees up like this. So this can be activities such as like sitting for a long period of time, going upstairs, just bending down to pick something up, sitting down to put on your shoes, or bending over to lift something up. So anything of that nature, any movement that basically requires flexion of your spine. You have 5 vertebrae. So you have 1, 2, 3, 4, 5. So all of this is essentially your lumbar spine, which is your low back. So these segments that's right over here is the disc that's in between each vertebrae. So when a disc herniation happens, typically occurs with bending or forceful bending, anything that's uncontrolled. And what happens with that is when you're bending forward, you're putting pressure on the front part of the disc. So if you can imagine, you have these 2 vertebrae here, and when you're closing in the gap, like this, you're essentially forcing the disc to go back because of the compression pressure on the front. So when it does that, it herniates posteriorly. And when it herniates posteriorly, you have nerve roots. These yellow things right over here, when it herniates posteriorly, it shoots back and hits one of these nerve roots. And these nerve roots are connected to the muscles of your leg, the muscles in your glutes, and that's essentially what causes the pain that's shooting down into the leg. So that's why people don't like flexion when they herniate their disc. All right, so the first set of exercises is a series of extension-focused progressions. So what does that mean? That essentially is taking your spine and going into extension. So the opposite of flexion, you're basically kind of bending backwards. And the reason for that, let me take the spine here again, is when you have a disc herniation, the whole idea of doing these extension progression based exercises is to take the disc material and put it back where it should be with extension based exercises. So when you're doing this, when you herniate something, you're going into flexion, the pressure's in the front of the disc, you're pinching down the front with compression, which then shoots the disc backwards. With extension based exercises, you're trying to put the pressure in the back of the disc, which then gets the herniated material back into the center of the location. So all these exercises that I'm showing you, you are to perform them to your tolerance or within your comfort zone. There may be a little bit of discomfort or it may make you a little bit sore, but it should not make your pain worse, especially if you're having leg pain that's shooting down. So if you're having leg pain when you're doing this, afterwards it should feel better. And if it doesn't, then you need to cross that exercise off your list. All right, now that I got all that out of the way, let's jump right into the exercises. So the first progression is just laying on your stomach prone. So all you're doing when you're doing this is you're just trying to lay on your stomach. You can kind of get rid of the pillow if you want to. So when you lay on your stomach here, just like so, you're already facilitating a little bit of extension. You're trying to just get your spine to go into neutral, just away from flexion. And then if this, usually people tolerate this pretty well with a disc herniation, this is pretty neutral. Now, however, with those acute disc herniations, meaning if you're very, very sensitive, what you can do is you can take a pillow and you can put it underneath your hips. So if you put it underneath your hips, you're not taking your spine completely into extension, especially if you can't tolerate it yet. There's still a little bit of flexion there, so it's a little bit more comfortable. And it makes it a little bit more tolerable for you. And if you can do this, if you can hang out here, maybe 30 seconds to a minute or so. But again, at the end of the day, everything's to your tolerance. It's got to be something that you can do, and it's got to be something that makes your symptoms a little bit better versus worse. All right, so now that we have neutral prone lying or just prone lying with a pillow, the next progression up would be prone on elbows. And prone on elbows, you're essentially just laying on your stomach on your elbows. So as you can see with my low back here, you're kind of going into a little bit more extension. A lot of times if people tolerate this pretty well, I have them actually in the clinic just play on their phone. If they can just hang out on their phone a little bit, just kind of get their mind away from the pain in the low back, have them watch a YouTube video or something like that, or have them answer emails on their phone. Whatever it is, at the end of the day, you're just trying to extend the ability for you to tolerate this position for a longer period of time. Next progression exercise from prone on elbows is prone press-ups. Prone press-ups is the next one up because from your elbows, now you're coming onto your hands and then you're pressing up. One key thing I like to tell people when we're doing this exercise is to keep their hips on the table. So by what I mean by that is a lot of times people want to push all the way up, and when they push all the way up, they have their hands too close to their body, and when they push all the way up, you can see like light through by the hips. So actually I want the hips to be on the table, and actually I correct them by having the hands forward more. So when they're pushing away on the table, they're actually folding the spine backwards, creating extension in the lumbar spine, versus when you're pushing over here, when you're pushing up, it feels like you're getting extension, but you're actually pushing yourself away from the table. So when people are doing this, I have them push up, hold it for about 10 seconds or so, and then come on back down and have them do this about 10 times. Again, with each one, as you do this, you should just feel a little bit of stretch in the low back and not having more leg pain that goes down the leg. So the next progression up is standing extension. So this exercise, you're putting your hands in the back of your hips, and then you're kind of stabilizing there with you're kind of adding a little bit of forward force, pushing this way. So as you're pushing forward just a little bit, you're just stabilizing, you're just bending backwards as far as you can go. And then you're coming back up. And then you're repeating that. I usually just have people do this about 10 times. And again, as you do this, your leg pain should not get worse if you have any leg pain, or your symptoms should not be getting any worse. There has been cases in the literature that I've came across where if you're having leg pain and you're doing this, and your leg pain actually gets less and less, but then your low back pain gets increases just a little bit, that's actually a phenomenon that we look for. So that's the process of centralization, where you're bringing the pain and localizing it back into the lumbar spine. And that's actually a good thing, because if you want to localize the pain, not spread it. So that was it for the series of progressions for spinal extension. So you essentially start on your stomach first, just prone lying. And if even that is not tolerable, you add a pillow underneath your hips to give you a little bit more flexion. And then from there, you progress into prone on elbows, where you're just hanging out onto your elbows. From prone on elbows, you go into prone press-ups. And then from prone press-ups, you go into standing extension. So at the end of the day, you're just getting more and more extension. And the last one is basically just your ability to be able to stand upright. So that's all mobility focused work. So next up, we have you want to strengthen actually into extension. So you want to do an exercise just like a bridge, something simple. So you want to lay on your back. Okay, as you lay on your back, all you're going to do is you want to press down on both your feet, and then you're just going to bring your hips up into extension here. So as you're coming down, you want to imagine unfolding each vertebrae one at a time. Okay, that also allows you to bring it down with control. It's also something that's safe for disc herniations. So when you're doing this, You want to go ahead and squeeze your butt, bring it down, bring your spine into extension, hold it for a little bit, and then bring it back down. So those are bridges there. So the last exercise is actually self-traction. So what you're doing with self-traction is you're taking, kind of remember what I was saying with the lumbar intervertebral disc, you're trying to open up and stretch the spine in an axial longitudinal direction. So when you do that, there's negative pressure that's inside the intervertebral disc, and the whole idea behind that, or at least the theory behind it, is that you're trying to, as you open up the intervertebral disc between the vertebrae and the disc itself, there's a negative pressure that sucks the disc material back in. So this exercise is what provides that for you. So when you do this, I typically have people go on, if you have like a pull-up bar, you can hang from a pull-up bar. If you have a long table, you can kind of hang from there. Or what you can do is you can use the door frame, like what I'm doing here. So you can't see it in the video, but I actually have a box underneath me because unfortunately I'm a little short. So because of that, I have this box to help me get to the door frame. So I just hang my arms on the door frame. And the most important part when you're doing this is you have to let your legs touch the floor. So when you let your legs touch the floor, this allows your trunk to relax. And when your trunk relaxes, that's when those muscles aren't preventing you from stretching into a longitudinal direction. So it actually allows the spine to open up. So honestly, I think just based on experience, I think having a pull-up bar or something that you can have a good grip is one of the best ways to do self-traction. But this works fine as well too. As long as you have a pretty stable door frame, you can grab onto the door frame and you just bend your knees. Just let your foot touch the ground. That's the most important part, and just keeping that relaxed. And then when you do that, you're basically just opening up. And you can hang here about 10 seconds, 20 seconds, and then just repeating that. I have folks that do traction multiple times a day or self-traction multiple times a day. Remember, when you're doing these exercises, there should be less pain by the end of this. You may be a little bit sore, or you may be a little bit fatigued from these exercises, but you should not have more pain and you should not feel worse when you're doing this. That's the big takeaway from these exercises. Try these exercises out. Let me know what you think. I hope you have a speedy recovery. If you enjoy this content, please like, comment, and subscribe, and I'll see you guys in the next one. Take care.